Addiction doesn't begin with a substance. It begins with a feeling, or more precisely, with the absence of one. Behind every addict is not a criminal, not a failure, not a broken will, but a human being trying to escape pain they never chose to feel. Addiction is not about pleasure. It's about relief. Relief from loneliness, from shame, from the quiet, invisible ache of disconnection that has been echoing since childhood. People think addiction is about substances, alcohol, cocaine, heroin, nicotine, but it's not. It's about what those substances temporarily fix. It's about a nervous system that cannot rest, a heart that doesn't feel safe, a mind that no longer trusts itself. It's the adult trying to soothe a child that was never soothed. We are born needing two things as desperately as air: connection and authenticity. Connection, so someone holds us when we cry. Authenticity, so we can be who we are without fear. But what happens when these two needs collide? When being your authentic self threatens the connection you depend on to survive? That's where addiction begins. A child who feels anger, sadness, or fear, but is told, "Don't cry, be good, you're too sensitive," learns that emotions are dangerous. They learn to hide their truth to stay loved. They disconnect from their body, from their instincts, from the raw energy of being alive. That's not rebellion. It's adaptation. It's survival. The tragedy is that what saved you as a child kills you as an adult. Because when you cut off your authenticity to stay attached, you also cut off your inner compass, the part of you that knows peace. So you grow up looking for substitutes. You drink to feel calm. You used to feel connection. You chase success to feel enough. You scroll, gamble, eat, shop, or fall into toxic love. Not because you want to destroy yourself, but because you don't know how else to exist without pain. Addiction is not about being weak. It's about being wounded. Think of it like this. The addict's relationship with the substance mirrors the child's relationship with the caregiver. Both offer fleeting comfort, followed by abandonment. Both demand dependence. Both feel like love but deliver pain. The bottle becomes the parent that never judges. The pill becomes the embrace that never leaves. The needle becomes the voice that finally whispers, "You're safe now." But it's a lie, a chemical illusion of love. And yet, when you've never known the real thing, even a lie feels holy. This is why addiction is not random. It follows an emotional logic. Pain plus relief plus repetition equals attachment. The brain learns that the only path to safety is through the thing that's killing you. From the outside, it looks insane. From the inside, it's mercy. The addict doesn't crave the high, they crave the absence of pain. They don't want to fly, they want to land. But society punishes what it doesn't understand. It calls addiction a crime, a moral weakness, a personal choice. We throw people in prisons, not realizing that what we're really doing is punishing pain. We have built systems that treat symptoms and ignore stories. We see the syringe, not the scar. We see the relapse, not the reason. We see the behavior, not the biology of trauma replaying itself in real time. And yet, addiction is the body's most desperate cry for connection. It says, "I'm hurting. I can't bear to be me." When you look into the eyes of an addict, you're not seeing pleasure, you're seeing anesthesia. And no one chooses anesthesia unless living hurts more than dying. Every addict started as a child who didn't get to feel safe enough to be fully human. A child who learned that to survive, they must numb their own heart. Addiction is the adult version of that numbness, upgraded, chemical, relentless. The drink, the drug, the screen, the lover. They all serve the same function: to make unbearable emotions bearable. The alcoholic isn't drinking to forget the party. He's drinking to forget the silence after the shouting stopped. The woman addicted to toxic relationships isn't looking for chaos. She's replaying her childhood, trying to finally make the unloving parent love her back. The workaholic isn't chasing success. He's chasing worth, the approval he was starved of when he was small. The overeater isn't greedy. She's trying to fill the emptiness where affection should have been. Addiction wears many faces, but the soul behind it is the same: unprocessed pain. And here's the most shocking truth: addiction isn't the problem, it's the solution. It's the brain's attempt to restore balance. The nervous system's way of saying, "I can't handle this pain, I need a substitute for safety." That's why willpower doesn't heal addiction. You can't command the brain to stop seeking safety. You can only teach it what safety actually feels like. Healing doesn't happen by hating the addict inside you. Healing begins when you start listening to it, because that voice of craving is not evil. It's your younger self asking for help. And that's what recovery really means: to recover what was lost. The ability to feel. The right to exist without escaping. The courage to be present in your own body again. You don't heal addiction by fighting the darkness. You heal by bringing light into the place where the child once froze. You recover when you remember that the opposite of addiction is not sobriety, it's connection. If addiction is born from disconnection, neuroscience now tells us exactly how. The story of every addict can be mapped inside the architecture of the brain. Let's start with a discovery from the Adverse Childhood Experiences Study, one of the most important pieces of research in psychology. Conducted by Kaiser Permanente and the CDC, it examined over 17,000 adults. The findings were shocking. The more adverse experiences a person had in childhood, abuse, neglect, household dysfunction, the higher their risk of addiction. With 4 or more ACEs, the likelihood of becoming an alcoholic increased by 700%. The risk of injecting drugs skyrocketed by 1,100%. In other words, trauma doesn't just hurt your heart, it rewires your biology. Here's how. During chronic stress, the body floods with cortisol and adrenaline, the hormones of survival. These are life-saving in the short term, but in a child who lives in constant fear, they become poison. Prolonged exposure damages the prefrontal cortex, the brain's decision-maker. That's why addicts often act impulsively. The part of their brain responsible for self-regulation was literally underdeveloped by trauma. At the same time, trauma shrinks the hippocampus, which controls memory and emotional context. This means the brain struggles to distinguish between past and present danger. A slammed door feels like childhood all over again. Then there's the amygdala, the brain's alarm system. In trauma survivors, it's on constant high alert. It detects threat everywhere, even when none exists. The result? Anxiety, hypervigilance, and emotional flashbacks that drive people to numb out. Addiction in this context is not rebellion, it's regulation. When you drink, your amygdala quiets. When you use, cortisol drops. The nervous system finally, mercifully, rests. And then dopamine comes in, the molecule of motivation. Every addictive substance hijacks dopamine pathways in the mesolimbic reward circuit, particularly the nucleus accumbens. But here's what few people know. Early trauma lowers baseline dopamine levels. Studies from Harvard and McGill University show that children exposed to neglect have fewer dopamine receptors as adults. Ordinary life feels dull, empty, meaningless. So, when a traumatized brain encounters a drug that floods it with dopamine, the effect is euphoric. For a moment, the world feels alive again. That's not weakness, that's neurochemistry. This is why Gabor Mate said, "The question is not why the addiction, but why the pain, because the pain comes first. The drug just follows." Even non-chemical addictions follow the same neural route. Gambling, social media, sex, shopping, even falling in love, all activate the same dopamine system. They light up the same circuits that drugs do, offering a temporary sense of control and belonging. In MRI studies, when heroin addicts are shown images of needles or social media users see notifications, their ventral striatum, the pleasure hub, explodes with activity. The anticipation of relief is as powerful as the relief itself. And when the stimulus is gone, dopamine crashes, leaving emptiness sharper than before. This crash feeds the cycle. The addict doesn't chase pleasure anymore, they chase normalcy. But the deepest damage of trauma is not just chemical, it's relational. Children who grow up in unstable or unloving environments often develop disorganized attachment. Their caregivers are both the source of safety and the source of fear. This creates a paradox the brain never resolves. I need you, but you hurt me. That's the same paradox addicts live with. I need this substance to feel alive, but it's destroying me. The pattern repeats. The drug becomes the caregiver, soothing yet punishing. The addict keeps returning, not because they love the pain, but because they hope one day it will love them back. Psychotherapist Bessel van der Kolk in The Body Keeps the Score describes how trauma embeds itself physically. The body stores memory in muscle tension, gut contractions, shallow breathing, and frozen posture. When a person uses drugs, it's not only the mind that relaxes, the entire body releases decades of defensive tension. That's why recovery must involve the body. You can't heal trauma with logic. You have to feel safe in your own skin again. Trauma-sensitive therapies like EMDR, eye movement desensitization and reprocessing, somatic experiencing and breath work all work by restoring connection between body and brain. In brain scans of trauma patients after EMDR, the overactive amygdala calms down. The prefrontal cortex, the seat of reason, lights up again. In other words, feeling safe changes your brain as much as trauma does. Even in long-term addicts, neuroplasticity remains possible. The brain can rebuild. Studies from the National Institute on Drug Abuse show that within 90 days of sustained abstinence, grey matter density begins to increase in the prefrontal cortex. Decision-making and emotional regulation improve. Connection rewires what isolation destroyed. Let's look at a real case that embodies this truth. A woman named Laura, name changed, 38 years old, addicted to opioids for 15 years. On paper, her story looked like failure. Multiple relapses, criminal charges, 2 overdoses. But in therapy, her story unfolded. As a child, she was sexually abused by a relative and never believed. Her mother blamed her. Her body became a source of shame. Her only peace was the numbness of painkillers. When she began trauma-informed therapy, she didn't start by giving up the drug. She started by learning to feel her body again, to breathe, to move, to speak her truth. Slowly, the need to numb herself faded. After 2 years, she was off opioids, not because she fought harder, but because she no longer needed to escape. The addiction disappeared when the pain was finally witnessed. That's the hidden medicine, presence. Compassion. Connection. Addiction isn't cured by control, it's healed by contact, with self, with others, with the body, with truth. Modern neuroscience confirms what ancient wisdom always knew. Human beings heal in safety, not in shame. When you give a person the experience of being seen, held, and understood, the same dopamine circuits that drugs once hijacked begin to activate naturally. The brain learns again what connection feels like. That's why recovery programs built on love, purpose, and community, not punishment, have the highest success rates. In Portugal, where drug use was decriminalized and replaced with treatment and social reintegration, overdose deaths dropped by 90%. Because when you stop treating pain like a crime, people finally stop running from it. Addiction is not a moral failure. It's an adaptation gone rogue. It is the body's attempt to survive in a world that didn't know how to love it. When healing happens, it's not about destroying the addict. It's about meeting the child inside them who's decided it's safer to disappear than to be hurt again. And when that child finally feels safe, the craving ends. Not because the brain was forced to stop wanting, but because the heart finally remembered what it was wanting for. Addiction ends where reconnection begins. Not when you punish the pain, but when you listen to it. Not when you force yourself to be strong, but when you dare to feel what once felt impossible. That's the psychology of an addict and the biology of healing. Pain turned inward becomes addiction. Pain turned toward compassion becomes freedom.